Hi, Anne. My name is Morgan. I'm a nursing student at St. Francis, and I'm going to be doing a postpartum checkup today. That's okay with you. First, I'll get your name and date of birth. Sounds good. How you feeling today? Any pain or discomfort? Okay, 2 out of 10. Just let us know if you need any medication to help with that pain. I'm first going to get your vitals, so I'll start with your temperature. I'm going to have you open your mouth, and so we'll go under your tongue. 98.7, so that is good, no fever. Next, I'm going to get your pulse. I'm also watching your respirations. Your pulse is 74 and your respirations are 18, so that is good. Then I will get your blood pressure. Blood pressure is 120/80, so that is good as well. And I'm also going to listen bilaterally to your lungs, so listen both sides, and then I'm going to listen to your abdomen for your bowel movement sounds. I'm going to pull up your gown so I can listen to your lungs. Okay, deep breaths. Lungs sound good. I'm going to listen to your abdomen. I hear bowel sounds in all 4 quadrants. When was your last bowel movement? Okay, a few days ago. And then have you been passing gas lately? Just a little? Okay, and you can let us know if you need any stool softener. We do want you to have a bowel movement. It might be slow at first because of the pregnancy, but just let us know if you need anything for that to feel better. Next, I'm going to palpate your breast. I just want to feel for any lumps, hardness, any tenderness, so please let me know if it is tender. I'm wearing gloves. I'm going in circular motion, and you can do this as well. Just feel for any hardness. Is it tender at all? No? Good. I don't see any cracks. If you do get cracks, you can always put some ointment on. Check the other one. Okay, looking good. And next, since I already listened to your abdomen, I'm going to feel for your fundus using the 2-hand technique. And it is about 1 to 2 centimeters above your umbilical cord or umbilicus. And you can actually feel it yourself with your hand. Each day it will decrease about 1 to 2 centimeters or 1 to 2 finger lengths. You should feel the fundus, which is the top of your uterus. It should feel firm in the midline. If the bladder is too full, it could be off the midline and it could feel a little boggy. We want to make sure that you're urinating as much as possible so you can heal and your fundus or uterus can return back to its normal position. Okay, and looking at your C-section incision, using the Rita method, there's no redness, no ecchymosis or bruising, no swelling, no drainage, and incision is well approximated, so that is looking good as well. Okay, and then looking at your IV site, I don't see any infection, redness, no drainage, no bruising either. And then with my gloves on, I'm going to look at your lochia quick. Okay, I don't see any clots. And then when was the last time it was changed? Okay, an hour ago. This is about light to moderate drainage. It's rubra, which is normal after birth. That should last only a few more days, then it will turn yellow. Yellowish, reddish, brownish, kind of. And then looking at your catheter site, I don't see any redness or discharge that shouldn't be there. Let us know if you do get a burning sensation or you can't urinate quite as well after the catheter, or any foul odor that could indicate infection. Okay, I'm going to pull that down, and then I'm going to look at your legs. Any tenderness when I palpate? No? Good. I don't see any redness. I don't feel any warmth. The best thing for you to do is to walk around as much as you can once the epidural wears off. Early movement is best to prevent any blood clots in your legs and also helps with any gas pains if you have those. Okay, I'm going to turn you over quick and look at your epidural site. Okay, looks good. No no redness, no ecchymosis, no swelling, no drainage. Approximating well. I don't see any hemorrhoids, which is good. I don't see any lacerations either. No redness or swelling or bruising or drainage. And whenever you do go to the bathroom, you can use the squirt water bottle, working your way from front to back to prevent any infection. Okay, everything's looking good. How are you feeling, other than the 2 out of 10 pain? Happy? Good. Do you have a good support system at home, like your mother or your husband or your partner? Good. Okay, and before you leave, we will try to give you some paperwork for any support groups that you may need if you have any issues. Like I said before, you can palpate your fundus, your uterus yourself. Make sure it feels nice and firm. Might be a little uncomfortable. You can also palpate your breast for any hardness or lumps. Could be mastitis. And then try to walk as much as you can to prevent any blood clots. And try to go to the bathroom as much as you can. And you can always come to us if you need any stool softener. So I'm all done. Thank you.